walk in the room, just wash my hands. Hi Wendy, my name's Lydia. I'm going to be your nurse today. I'm going to be doing a head, eyes, ears, nose, and throat exam on you. Do you have any cultural or religious beliefs I should know about?
No, and that'll be fine.
Okay, and there's nothing that will affect our practice that could be part of our health exam that I need to know?
No.
Okay,
Good.
great. And how are you feeling today?
I feel fine.
You feel fine. Good. From your presentation, you also look fine. It matches your mood. I'm also looking at your head. It's symmetric, and your eyes, nose, mouth, all those things look appropriate in size. I see that your skin is intact and dry, and no obvious lesions or deformities that are popping out. We're going to start off with the head. I'm going to ask you some questions. Do you have any chronic headaches, head injuries, concussions,
No.
dizziness,
No.
stiffness in the neck or lack of range of motion,
No.
pain or tenderness?
No.
Okay, great. I'm going to go ahead and look at your head. It's normal cephalic, which means it's a normal size. And as I palpate, you're going to tell me if you feel any pain.
No pain.
No pain. And no tenderness?
No tenderness.
Okay, great. As I'm palpating, I'm just feeling the contours, seeing that there's no depressions. It's smooth. There's no lumps or bumps, lesions that I felt. So that's great. We're going to go ahead and then do I'm also looking at your face, at your mouth, making sure that there's no involuntary movements like twitching, and then also that they're equally moving up and down, no drooping or any signs of weakness there. I'm going to go ahead and then palpate your temporal membrane, and that is +2, no bounding, regular and rhythmic, and then go ahead and open and close your jaw, and that's smooth, and no tenderness or pain there.
No.
Good. We're going to go ahead and go with the eyes. Do you have any, do you wear any eyeglasses or contacts?
No, but I just had cataract surgery.
Oh, okay.
And I have had a history of PRK about 20 years ago.
Okay, thanks for letting me know. Was it any complications with cataract surgery? Is it causing any ocular vision problems now?
No.
Okay, great. Do you have any blurred vision, blotchy vision,
No.
excessively dry eyes,
No.
or drainage or exudate that you've noticed?
No.
Okay, I don't see any scaling. I don't see any swelling or redness additionally. Any pain or anything?
No.
Okay, good. And thank you for letting me know about those ocular problems. We'll keep that in our records and keep that in mind as we go through the presentation. We're going to do a couple visual tests. If you'll just stand over there, 20 feet, we're going to do the Snellen chart. And I'm going to have you cover one eye, and then I'm going to have you read this line right here. DEFPOTEC. Great. That's a 20/20 vision, and then you're going to cover the other eye, and now we're testing the right eye, and go ahead and read this line.
I have monovision.
Okay.
I need the
Oh, okay.
for that eye.
Okay, gotcha. So unable to complete this side? Okay.
Yes.
And then what color is this?
Red.
Okay, great. So 20/20 vision on your left eye, and then are you able to, can you go back and, with your other eye, cover that up, and then what's the, can you read this one?
TOZ.
Great. And this one?
LPED.
And this one?
No.
Okay, so you have 20 out of 50 vision on your right eye. Perfect. Come on back. Your color is intact and you're not colorblind, so that's great. I'm going to hold this 14 inches from your face, and you're going to read this line here.
638.
Perfect. Can you cover up one eye? And then if you'll please read this line.
8745.
Okay, and then switch eyes and read this line.
8745.
Good. So 14 out of 14 on nearsighted. You weren't moving the card, and didn't see any hesitation with that. So we got that vision correct. And then we're going to do the peripheral test. So I'm going to have you cover this eye, which is your right. And as you, I'm going to bring up my finger, and when you see it, say now, please.
Now. 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 Now.
Okay, great. Now we're going to cover up the other eye, and again, we're going to do the same thing.
Now. 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 Now.
Okay, great. Peripheral vision is intact, and you were able to identify those fields in the 90, 70, 60, and 50 degrees. We're going to do the 6 cardinal gaze field. Oh, I need my pen light. So, just making sure you're in the film. Okay, good. We're going to do 6 cardinal fields, and while I do this, I'm going to be looking for any extraocular movements. So go ahead and follow my pen. Great. So no nystagmus was noted, and no extraocular movements. It looks like there's no weaknesses there. That's fantastic. As we go on, I'm just looking at your eyebrows and the external eyelashes. They are evenly distributed, and I don't see any lesions, swelling, exudate, scaling of the skin. They don't look red, and no signs of infection there. We're going to do the lacrimal lenses. I'm going to have you look down, and then I'm just going to just going to pull up a little bit, and then I'm just looking for any drainage buildup here and any kind of swelling. So I put pressure on your lacrimal ducts, and there was no drainage or exudate that came from that, so no response is a good thing.
Great.
And there's no edema or redness. I'm gonna now look at your conjunctiva, and I'm gonna pull down as you look up. Perfect. And the conjunctiva is clear, so I should see it being white over the sclera, and then it's pink at the bottom because the conjunctiva is clear. I don't see any cyanosis or redness of the eye, and no lesions. Alrighty. We're gonna go now on to the, what happened here? The retina, and, oh no, I'm sorry, ooh, this got out of order. Okay, there we go. Okay, so now I'm going to be looking at the sclera. The sclera is the white part of your eye, and it is china white, which we like. I don't see any bursted blood vessels, and again, there looks to be moist and clear, and we don't have any foreign bodies in there. I'm going to take my light, and we're going to look at the side of the cornea and just make sure that there's no opacities. And I don't see any. It's clear, no abrasions, and in that eye. Again, I'm gonna come in on this side, looking at the cornea. No opacities. It's clear, translucent, and no abrasions noted. I'm gonna also do the corneal light reflex, which I'm gonna hold this midline, and you're gonna look straight ahead, and then I see that both of the light reflexes were symmetric in both eyes, and that's a expected result. As I looked in the iris, I am looking just for even color, even distribution. They're round, and that is what is presented here, symmetric in both eyes. We're going to now do the pupil dilation test, pupil contraction. So go ahead and look at the wall. And it's dark enough in this room that we can do it like that. I'm looking at your eye pupils, and they're already at a 3, which is a normal finding. And when I put light on them, they're contracting to a 2. This is direct light on your left eye, and it is contracting. I'm going to now do it on your left eye again and see that the right eye contracts. So consensual light retraction of the pupil is present, which is a normal result. And then again, I see that the pupil contracts on the right eye when direct light hits it, and now I'm going to be looking at the left eye as I hit the left. Perfect. So you have direct light reflex intact, and the consensual reflex as well. We're going to test for accommodation, which means you're going to look at that wall, and then you're going to look here, and then at the wall, and then at my pen. Okay, and I can see that your pupils are accommodating and constricting. We're going to follow the pen all the way to your nose. Great. Converging and constricting, accommodating, your pupils are, and so are your eyes. They're tracking correctly. So that means that this perla, pupils are equal, round, reactive to light, and accommodating. We have no problems there. We're going to go into this darker room, and I'm going to, that's perfect right there. In the darker room, I am going to do some further analysis with the ophthalmoscope. So basically I'm going to come in at a 15-degree angle, and I am checking first off for a red reflex, and right off the bat I see that red reflex. As I go in at a 15-degree angle, I am checking to try and find that optic disc. And once I find it, I've tracked the vessels to the optic disc and recognize that the cup is 1/2 the size of the disc. It's a creamy orange color and it's round, it's 1 dd. Following the vessels around the fundus and the vessels, the artery. The arteries are a brighter red and have that string of highlight in the middle, so I can tell that they're the arteries. The artery vein ratio is 2 to 3, and I can see that they're not crossing at all in this eye. I'm going to also look at the macula. In the macula, I'm going to have you look at the light, and it's going to be uncomfortable just for a second, and I apologize. And so in the macula, I can see that it is at 2 o'clock temporally and 2 dd from the disc. Additionally, it's a little bit of a darker color, and I can see that, and there's no like lesions or anything there. I'm looking at the retinal background and making sure that all of the color is consistent with the background. There's no abrasions, hemorrhaging or aneurysms, lesions or abrasions that I can see. So that looks like a good eyeball. We're gonna do the same thing on the other eye. Again, coming at a 15-degree and tracking that optic disc. Let me just make sure that there wasn't anything specifically missing from that last one. Okay, 15 degrees. Actually, I'll have you just scoot over a little bit so we can stay in the screen. Gonna come in at a 15-degree angle. I see that red reflex fill up the pupil, and then as I go in, I see I can track that optic disc following the vessels to the disc. This cup again is 1/2 the size of the disc, and the disc is a orange, just like the other side, a creamy orange, and it's 1 dd and it's round. Tracking the arteries and the vessels, they're not crossing. The arteries are that brighter red and have that highlight down the middle. I'm also looking at the fundus, no abrasions. I don't see any hemorrhaging or aneurysms, and no lesions in there. I'm gonna have you look straight at the light for a second as I do the macula. Oops. and I know it's uncomfortable. The macula, as I locate it, is 2 o'clock and 2 dd from the disc temporally, and the macula does have that little bit of a brighter or a darker color, so I can see that. Alrighty, no lesions there. Alright, I believe we're good there. You can come on down. That completes the eye exam. And I'll turn off this and kind of get us back in order here. Okay. We're now gonna go on to we will now be going on to the hearing. Do you have any hearing loss concerns? Have trouble hearing? Ever had vertigo? Is your occupation in a loud area?
No.
Okay. Any exposure to harsh sounds consistently?
No.
Okay. Any earaches?
Not in a long time.
Okay. Ear infections, chronic ear infections?
No.
Okay, good. And any exposure to smoke or secondhand smoking?
No.
Okay, great. That's great to hear. We're going to now inspect the ears. I see that your ears are bilateral. They look exactly the same color as your face. I don't see any exudate, any drainage pooling out of them. They're not red. There's no sign of infection. I don't see any foreign objects or anything like that. As we start to touch them, I'm going to do a tug test where I pull up on your ear, and you're going to tell me if there's any pain with that or tenderness.
No.
No? Good.
No.
Okay, that's wonderful. So the tug test, there is negative, no pain or tenderness there. I'm going to now also palpate the trigeminus, the mastoid, and then the helix in the ear, and let me know if there's any pain there.
No.
Okay.
No.
Okay. Alrighty, we're going to look inside the ear. As I look inside the ear, I am checking for any swelling, any foreign objects in there, the amount of earwax, and if it's patent. And so with an adult, I'm going to be pulling up and back as I go in. Alright, so looking for that patency, any signs of redness or infection. And then once I get back there, I can see the tympanic membrane. It is pearly white. I see the cone of light in that anterior inferior quadrant, and I do not see any perforations or redness, so that's a good sign. We're going to do that
Great.
on the other side. Going in, checking the patency, pulling up and back on that pinna, and then finding that pearly gray tympanic membrane back there. Everything in here, the mucosa is all shiny pearly gray back there. No perforations noted. I see the cone of light and that anterior inferior cone, and no redness. So no drainage or anything like that noted either. No signs of infection.
Great. Thank you.
Yay! All right, we're gonna test your hearing a little bit more. So I'm going to stand 2 feet behind you. You're gonna close one of your ears, and I'm gonna whisper 3 letters, and your 3 letters or numbers, and you're gonna let me know if you're just gonna repeat those. Okay? Okay.
2, 4, 8.
Perfect. I'm going to go to the other side again, 2 feet behind you.
6, 1, 8.
Perfect. So you got 6 out of 6. That's a passing score. No problems with your hearing there. We're going to do the Wibber test. I'm going to do bone conduction testing here. So the vibrations will go down, and we'll see what side, if both or it's lateralizing. Let me know what side you feel this.
or hear it? Both.
Perfect. Okay, that means that you have equal bone conduction going down, and there's no lateralization. Tell me when you stop hearing this.
Now?
Can you hear that?
Yes.
Okay, good.
Do it like this so that they can see. Now?
Can you hear it?
Yes.
Okay, great. Air conduction is greater than bone conduction bilaterally in both ears. And I'm going to do a vestibular apparatus testing, so just go ahead and stand up for me. And then we're just going to make sure that you stand, close your eyes, and for 20 seconds you're just going to try and maintain that posture. As you're doing this, I'm looking for any involuntary movements, any swaying, any kind of unbalance that may be going on. It looks like she's able to maintain this and hold this. No problem. Great, thank you. Okay, you can take a seat again. And now we're going to go to the nose. Okay, as I'm looking at your nose, initially I'm looking at the outside. The skin is the same color. I don't see any lesions, redness, excessive exudate, excessive drainage, or any signs of infection. No deformities right off the bat, and anything like that. It's also midline and appropriate to the size of the rest of your face. As I'm gonna go in, I'm going to use this guy. We'll be looking at your mucosa in there. Okay. Just gonna have you tilt your head back, and I'm gonna push up your nose a little bit. Perfect. I'm looking inside the mucosa. It is red and moist as expected. No blockage, no foreign objects, and no swelling in there. And I'm looking at the midline, no septum deviation noted. Again, mucosa is red or light pink and nice and moist. No swelling or foreign objects, and no septum deviation noted. Everything is in midline. Perfect. Sorry if I tickled you there. All right, I'm gonna start looking at your mouth now after I clean my hands. We're gonna check out that mucosa in there. Any nosebleeds or anything? No.
Very infrequently.
Okay, good. No. Glad to hear that you're looking good so far. We'll do check out the mouth mucosa. As I'm looking around, I'm checking the color, which is moist and pink all around. I'm seeing the Stenson ducts in the back, and those are normal. I don't see any lesion, polyps, nodules, white spotches, or any signs of infection there. I'm going to ask you to put your tongue to the top of your mouth, and I'm going to look at those ducts, and I see the big vein at the bottom. Perfect. I don't see any nodules there or any white patches. I'm going to ask you to stick out your tongue, then I'm just going to move it a little bit to the side. No white patches, and I don't see any white patches or nodules. And then just bite your teeth together, and I see that her teeth are white, straight, and they are evenly spaced, and that the upper aligns with the bottom, so that's a good clench. I'm going to ask you to open your mouth once more. I'm looking at the top palate, the white palate, or the hard palate is a little bit more white and has those transverse ridges. And the black one is gonna be a little bit softer, a little bit more pink. No signs of bleeding, exudate, or any type of problem there. And then just one more time, and can you go ah with your uvula? The uvula is midline, it rises midline, and the vagus nerve is intact. Looks good. One other thing I'm just gonna check real quick is just your gum line, just to make sure that there's no retraction or coming back from the gingival receding, and it doesn't look like that for you. Alrighty, all of the, oh, not finished yet. The appropriate amount of saliva and anything like that was also noted. The vagus nerve is also intact when you go so that's great. We're gonna check the neck now. I'm just looking for the symmetry of the neck. It's midline. As I'm looking, I'm not seeing the carotid arteries pulsating or bounding. I don't see any asymmetries right off the bat. I don't see any enlargements or lesions. The skin, it matches the same color as the above. So negative for any kind of goiter possibility there. I'm going to feel your lymph nodes now. As we go down, just tell me if you feel any tenderness.
No.
Okay.
No.
Okay, good. So they were soft and supple. There was no movable, and they weren't like enlarged or anything like that, any painful at all. And then I'm also going to press on your sinuses here, and just make sure that, do you feel any pain or tenderness there? Okay, good. Sinuses are firm but non-tender, which is also a good sign. The lymph nodes as well, non-tender and discrete. I'm also going to now palpate your thyroid or your carotid, and that's rhythmic, +2 non-bounding, regular rhythmic +2 non-bounding as well. Awesome. I'm going to do a just check for your thyroid gland, which I'm going to feel for the trachea behind, and then ask you to swallow. Great. It was non-noticeable, no clinical findings there, which means that it's not enlarged or anything. Awesome. Thank you so much. I think that wraps up our exam. Do you have any questions?
No. Sounds like I got a clean bill of health.
Yes, you do. Okay. Well, have
Great.
a great day.
Thank you.